This presentation is about drawing on synchronicity or meaningful coincidence in psychological therapy. So synchronicity involves uncanny, meaningful coincidence, where the more uncanny and meaningful, the stronger the synchronicity, and then the greater its transformative power. So this is a case study, we'll call him Eric, who presented in his early 30s with a serious alcohol and ice addiction, chronic depression and a trauma history. I saw him for 6 months using CBT therapy, before which he booked himself into an overseas drug rehabilitation program. And he later told me this story about a synchronistic experience that saved his life. But he only told me about it when he learned I'd been writing about synchronicity, because he otherwise thought I might have thought that he was borderline psychotic. Eric described having been at a very low ebb just before he booked into the rehabilitation program. At one point, he was kneeling in front of a window. He had a pistol in his mouth. He chipped a tooth as the pistol barrel went in his mouth. He was about to shoot. But across a tennis court, he could see a blackbird like a raven that suddenly took off at full pelt, smashed in front of the window in front of him and fell down dead. He took the pistol from his mouth. He thought, that bird sacrificed itself for me. I'm meant to live. And with that interpretation, it helped him succeed in the rehabilitation program, alleviate his anxiety and depression, some of which he experienced as he made changes after that, but it helped long-term resolution. And he described then that I've been getting these messages all my life. When I'm in touch with me and my inner feelings, I'm aware of synchronistic good things happening around me. That's my higher power. That's synchronicity. He's since married, fathered a child, functioned well with a full-time return to work and responsibility, had enhanced family relationships, no lapses since, over several years, and our therapy sessions took a deeper quality. This example shows how synchronicity can promote uncommon therapy breakthroughs. It can enhance long-term outcomes. It can help alleviate mental disorders. It can also promote the positive pillars of well-being, as in the PERMA model. So then we can think of acknowledging synchronicity in therapy as potentially being a transpersonal positive psychology intervention, but the client might only acknowledge it if given permission. I describe other cases in my book, The Positive Psychology of Synchronicity, and questions we can use to elicit clients' experience. Further information is available at the websites synchronicityunwrapped.com.au and chrismackey.com.au. Thank you.